Visit with Dr. Hakeem from the medical director of the Sacramento Native American Health Center. Dr. Hakeem, are you there?
Yes, I am.
All right, there you go. So we're talking about vaccines today and how important it is and the push that we're trying to get everybody to get vaccinated. So let everybody know, how safe are they and what are the myths that they need to just forget about?
So it's a great question. So first of all, the vaccines are very safe. Millions of people in the United States have received the COVID-19 vaccines, and these vaccines have undergone the most intensive safety monitoring in U.S. history using both established and new safety monitoring systems. And all three of COVID-19 vaccines have been authorized by the FDA and have been shown to be safe and effective in clinical trials. In addition, these vaccines were authorized only after it was found that they make it substantially less likely that you'd get COVID-19. And we have the U.S. vaccine safety system that ensures that all these vaccines are as safe as possible.
And you know what? I know that a lot of us here in the Imperial Valley, we're getting our vaccines left and right, and everybody is doing just fine. So it's very important that people know, because some people are just kind of scared. Maybe they're worried they're going to do something with your information when you sign up. It's so easy. It's like your name and your birth date, and you're off.
Yeah, exactly. And the other thing about it is that the vaccines teach our immune system how to recognize and fight the virus that causes COVID-19, and it stimulates your immune system to produce antibodies that can fight off the real disease. It usually takes about 2 weeks after you receive the vaccine for your body to build up protection, also known as immunity against the virus. And after you get vaccinated, the developed immunity allows your body to fight it off naturally. But one of the things that people need to recognize is that none of the vaccines contain any coronavirus, and it cannot give you COVID-19.
And I think that's what some people are worried about. It's like, oh, they're going to give it to me. And you know what? It's time for us to go out and play. Everybody is ready to play, and we're really not going to be able to do that. And until we get to that herd immunity, California doing really good at like 50%, but we need to get to that 70%, right?
Yeah. There's been some reports that 70 to 85% would definitely help build up herd immunity and community immunity to allow for us to get back to doing a lot of the things that we love to do that we haven't been able to do over the last year.
Hug and kiss. That's what I'm missing the most, hugging and kissing my family.
Yeah, definitely. I can completely understand that and can appreciate that. It's been a challenging year in that regard.
It sure has. Okay, so now it's time for the little ones, 12 and up. How important is it for us to get them vaccinated as they're going to try to go back to a normal school year?
So great question. It's really important to get the children vaccinated. Early in the pandemic, kids only made up around 3% of the cases. But the American Academy of Pediatrics has recently released information that let us know that almost a quarter of all new cases are from children. So getting them vaccinated gets our communities better vaccinated, helps protect those that weren't able to get vaccines earlier. It helps protect our younger family members from getting COVID-19. So it's just a benefit to all of us.
I think it really is. And as a matter of fact, we're getting ready to open up a whole bunch of vaccine clinics for our 12 and up here. And I'm going to talk about that after you and I get done talking. So anything, that we really need to know. Now, I know that you actually with the Native American Health Center, you're looking for the smaller communities, the little niches, the people that are overlooked to get them vaccinated. This is one of those communities right here in the Imperial County.
Yeah, it's important to take care of our marginalized, those that are considered underserved, those that have been affected by COVID-19 in new movable ways. So we really want to make sure that we're reaching out to those communities. And I also think about our multi-generational homes. I know I come from one where we have young children, we have the middle-aged adults, and then we have our older population, our elders. And we want to make sure that all three generations are taken care of during this time. It's really important that we do that so that we don't lose a lot of those traditions and a lot of the learning that we've had over the last several years.
Yeah, and I think a lot of us are, reaching out and getting our older ones vaccinated. Here in the Imperial County, they're sending out the mobile units to our smaller communities, making sure that we can get to them. Even the ones that can't leave their house, we will send somebody to their home to make sure that they get vaccinated. And the Imperial Valley, we are very proud. We're only like 185,000 strong. We're coming up on 150,000 vaccines in our community with most of our adults already vaccinated. So I think we're doing really good right here, and I think it's important that everybody does the same with their communities, right?
Yes, that's spectacular that you've been able to vaccinate that many people in your community, and I applaud the efforts that have been made. And when we think about trying to sign up for the vaccine, some people are still trying to figure out where they can go. So there are a lot of different ways that we can go about it. So all people that live in California can book appointments through myturn.ca.gov or call the COVID-19 hotline at 1-833-422-4255. And in addition to that, the state has really put in a lot of effort to equitably and efficiently distribute vaccines. And they use on the website itself, they have information in Arabic, Armenian, Chinese, both traditional and simplified, English, Farsi, Japanese, Khmer, Korean, Punjabi, Russian, Spanish, Tagalog, and Vietnamese. So they really are trying to cover a lot of the bases. And in addition to that, they still provide language support for up to another 250 languages for those that may not have internet or email access, which is a lot of us.
Right, and that's a big problem, and I know that our community, the younger ones, really helped out when we were first getting the older ones, our seniors, getting them vaccinated. So as long as people do that, and it's really not that hard. Once you can get somebody a little computer savvy, it's easy to navigate that myturn.ca.gov. That's the way I went, and I know a lot of people use that.
Yeah, and in addition to that, thankfully, the pharmacies across the state are approved to administer vaccines to the public as part of the federal retail pharmacy program, and our primary care providers, whether that be the larger health organizations or your community health centers, have been able to vaccinate the community. So as supply begins to increase, more and more of our primary care providers will start to receive supplies of vaccines and vaccinate their own patients in the communities that they serve. And then in addition to that, you can call your primary care provider to see if they're providing it, or you can look at vaccinateall58.com for additional information.
Yep, I know. Well, we've got bases covered, that's for sure. So there's no reason for nobody to get their vaccine, because vacation's coming up. We didn't get to make a vacation last summer, and everybody wants to go out and play. So let's get vaccinated, California. I thank you so much, Dr. Hakeem, for giving us a call and, speaking with us about this, as the entire state of California is just trying to get through it, because we were one of the hardest hit states in the beginning. And look where we're at 1 year later.
Yes, we've done some great work. Thank you for having me on today. All
right, you take care and you keep up the good work, Doctor.
All right, thank you. You too. Take care.
All right.
Bye.
It's the best oldies. We're AM 1230 KXO. Okay, so now we're talking about the kids, all right? We've got the vaccination clinics for the kids. Vaccines are available for ages 12 and older. Appointments are not required. They can schedule them if you want to at myturn.ca.gov. Clinics are going to be this week. They're going to be held Thursday, Imperial High School Community Clinic. That's at 517 Barione Boulevard from 9 a.m. until noon. Thursday afternoon at the Imperial Valley Center for Exceptional Children. That's at 1520 South Waterman in El Centro from 2 until 5 p.m. And then on Friday, vaccines are going to be available from 1 p.m. to 4 p.m. at the Department of Social Services on South 4th Street in El Centro. As the kids are getting ready to go back to school, let's get them vaccinated.
All right, boys.
Imperial County Air Pollution Control District provides you with air quality reports daily. How is your air quality today? Check current air quality conditions in Imperial County at imperialvalleyair.org. You can sign up for free air quality alerts to be delivered directly to your email address, or you can download the Air Quality Alert app to your mobile device today. Stay informed with Imperial County Air Pollution Control District.